So New York City's 911 system receives around 200,000 calls annually regarding issues of mental health. And in the last 5 years alone, 16 people experiencing mental health crises were shot and killed by a police officer. 14 of those people were people of color. Do you support removing police officers from all mental health responses? Yes or no? If no, why not? If yes, how will you ensure that there are robust and fully accessible community-based emotional wellness programs that both prevent mental health crises, but also respond when there's an emergency, especially in Black, Latinx, and other communities of color? In addition, do you believe peers, people who've experienced a mental health crisis themselves, have a place in this response?
Well, thank you for that. And my answer is no. We should not remove police from responding to incidents of crises of that magnitude. What we must do is reduce the encounters between police and those suffering from mental health crises, particularly in the areas where it's non-threatening, no one's life is in danger. But I have personal responses. I know what it is to respond to someone going through a crisis, and they're carrying a knife, they're carrying a bat, they're carrying a metal pipe, like the individual who took the life of 4 Chinese citizens in Chinatown last year. It's a very serious encounter when you're dealing with someone who's going through a mental health crisis. The substantial number of the 200,000 cases that were nonviolent, then you could have a proper response team go. Once we identify that it's not a dangerous situation and no one's life is in danger, the person who is going through the crisis, as well as his family members. I've walked into buildings and I walked into homes where a person was threatening the life of a loved one because they were going through some form of crisis. We have to be extremely careful and not allow the thoughts that you don't have very dangerous encounters, and you must handle them safely. And I also believe if once we decide to have a combination of mental health professionals and EMS, we need to pay them accordingly. It is unfair to have EMS employees do this job without giving them the proper pay parity that should go with it. We can do a better job in handling the mental health crisis. I strongly support the CCIT proposal for non-police alternative mental health crisis response, but they're doing it in a smart way. 2 pilot projects, 2 precincts at a time, 24 hours, 7 days a week. That is the way you do it. When you make a major change in policy at this level, you must do it in a level that's not going to endanger the life of city employees who are responding, family members who are on the scene, as well as the person who's going through a mental health crisis. You cannot make these major changes without ensuring you're not jeopardizing the life of the people who are responding. I would never put a psychiatrist, an EMT in an environment that could jeopardize their safety or harm them in any way, or use the wrong tools to protect that person who's going through the crisis. Use non-lethal weapons and non-lethal tools such as the bowler wrap. I attempted to get the police department to use that. It's a non-lethal tool that would not harm a person, and you can subdue them without harming themselves. And so, to be very direct, I will never put a city employee, psychiatrist, family members, or anyone else in a situation that you could endanger the lives of innocent people or the person who's going through a mental health crisis. So no, I would not just openly state under no circumstances should a police officer respond. They should when it's needed, but they should not when it's not needed.
Thank you, Borough President.